What questions do you ask your patients?
I think the most important thing that one wants to know is what they're trying to achieve. Sometimes people will say, well, what do you think I should do? And it's really not what I think that matters, it's what they think. And my phrase I often use to them is, if you had a magic wand and you could wave it and change things, what would you like to change? Where would you like this procedure to move you to? And it's very important that the individual has as accurate an idea in their mind as they can of what they want to achieve, because, as they say, if you don't know where you're going, very unlikely you'll ever get there. And perhaps the most important thing in assessing a patient, particularly nowadays, is expectation, because we can change things within certain anatomical limits which are achievable and which are safe, but you can't just do what you like. And if you read, we're so influenced nowadays by what's on the computer and what's in the magazines and everything else, I think it's very easy to be led to believe that things can be achieved that can't be achieved. And by far the commonest cause of dissatisfaction in surgery done for appearance is not technical problems, although of course they do happen. But the commonest cause of dissatisfaction is an expectation which was never going to be realised. And it can be quite difficult actually to get inside somebody's head to know what it is that they're wanting to get out of it. But that's the most important thing that I want to know. And then I want to know about their lifestyle, what they do for a living, how much time they can take away from work, whether they've got 3 young children at home they've got to look after and haven't got any help, whether they smoke, very important. Nowadays, whether they use recreational drugs, particularly in rhinoplasty, not a question I would have asked a few years ago, but do now. So all of these things feed into, and then of course the routine things about their general health and whether they're taking any medication, whether they have any allergies, all those sorts of things.